Hi, Ivy.
Hi, Dr. Katie.
It's good to see you again.
Thank you.
So I read that you're having a lot of back pain.
Yes, it kind of radiates towards the shoulder as well. It's mostly the right side.
Right side.
Mm-hmm.
Okay. And is it confined to your upper back or lower?
It's kind of upper back.
Okay.
It radiates to the shoulder a little bit, and it also kind of goes to like the scapula, the shoulder blade right here.
All right. Any arm pain?
No.
Okay. What is your sleeping position?
That's a good question. I sleep in a really weird position, so I'm usually like on my belly. I don't know, I'm like twisted. I'm really twisted when I sleep. It's weird.
So sort of a pretzel position.
Yeah.
Which could, I hate to say it, be contributing to some of your problems.
Yeah.
But have you been sleeping in that position for a while or for years?
Yeah.
Okay, all right. And when did the pain start?
It started to get really bad like maybe a couple months ago.
Okay.
And at first I thought like, oh, maybe it was just, I don't know, sometimes you wake up and like something hurts and after 2-3 days it kind of goes away.
Yes.
I thought it was going to be something like that, but it's just been progressively getting worse.
Okay. Do you remember any accidents before the pain started? Any incidents, like maybe you were out doing something different physically that you normally do?
Not really.
No?
Nothing that I can pinpoint.
Have you had this type of pain before?
No, not this bad. Like I said, I thought it was going to be like before. Sometimes I get like some pain and it goes away.
But it's been going for a couple months now. Okay, so any history of back problems in general, anything? No?
No.
Okay. Okay. I'm going to have you get up and I'm going to examine your gait. I'm going to look for pronation of the feet and see if I can pinpoint where the pain is stemming from posture-wise.
Okay.
And then I'll be more informed to do some work on your neck and back. Okay?
Sounds good.
All right. So first I want you to take a couple steps towards me.
Okay.
Okay. All right. Stop. I'm seeing a bit uneven pronation of the feet. If you could turn around and walk forward. Okay. All right. So come again towards me. I want you to turn around now.
Okay.
Okay. Hands to your sides. All right. Now if you could turn your body here, I'll show you. Turn your body this way so you're touching your hands to your knee.
Okay.
All right, good. All right, and when you do that, try not to bend your head. So just keep your head kind of straight.
Like
Yeah,
this?
like don't effort with your, just like that. Okay. That's not too bad, actually. Could you do it on the other side? All right, great. And now could you take your hands and then go forward? I just want to see your spine here. Okay. I see a little deviation of the scalene muscle. And what's interesting is I'm actually seeing it on the left side as opposed to the right. So I think that sometimes when our problems stem from one side of the body, the pain can translate to the opposite side. But what we want to do is target the area where the problems are happening. So go ahead and stand up. Okay. Now I want you to walk back and forth again, but this time just pretend like I'm not there, just how you normally would walk. Okay. All right. So you have a pretty steady gait. All right. If you could turn around.
Okay.
Okay. And just turn your head, look to your right. All right. Now, do you mind if I put your hair up just for this part, just so I can have access to the neck? I am just going to do some assessments of the base of your spine and where you're choosing to okay. All right. Okay, I'm going to be palpating here the base of the mastoid bone.
Okay.
What I want you to do is turn your head, keep your shoulders where they are. You have a really beautiful way about your shoulders that they're not too hunched or too low, so I'm pleased with that, but I want to see how you're moving your head.
Okay.
So if you could turn and look this way slowly. All right, go back to center. All right, do it once more. Okay, and if you could hold just for a second, I just...
It does feel pretty tense.
I'm feeling a lot of muscle tension, and it is on this left side. Definitely. So you have almost like a lump here, but what I'm feeling is muscle mass. So it's something that can be smoothed out. It's just from built up probably over the years of you in that sleeping position, and also the way that you carry tension in your body. You do favor the left side. It's a lot more tense. So if you go ahead and look to your right now. Okay, now this is much better. Still some tension here, but nothing out of the ordinary like your left side. Okay, I'm just gonna palpate the scalene muscles here. Okay. So with the physical structure of your scapula here, they are more wide set, which just makes you more prone to holding tension on one side of the body because you have a lot of space in between these two muscles. So I think you'll really benefit from just what I'm going to be doing with the treatment on a regular basis. So coming in maybe once a month, once every 2 months even, whatever you can manage, just to reinstill this tension to be released. Okay. Okay, I'm going to check for scoliosis and lapidosis. So if you could just go ahead and try to touch your knees and bend lower. Okay. All right, I'm sorry, I was not clear on that. If you could start by rolling down from your head, just like that, yeah. And then slowly bend down the lead there. Okay. Okay, you can stop. Okay. No signs of scoliosis. I'm feeling a very normal curvature, so that's good. You can pull that out. All right, go ahead and stand up and relax. Okay, so what I want you to do next is go ahead and make kind of a lunge here. Just like move your knees directly in front of you. Try to keep your core balanced and upright, but I just want to see the way that you bend your knees and these muscles here. So go ahead and do the movement. Very good. You can hold the table for balance, but you really shouldn't have to if you're doing this properly. Start more from a place of keeping the back leg straight. Okay, just like that. Let's see. If you hold any tension of the knee, let me know if you feel any pain.
Yeah. I have been feeling like it cracks sometimes when I bend the knee.
Okay.
And there's a tiny bit of pain, but nothing crazy.
Okay. So the cracking could be a number of issues, but I'm definitely going to refer you for a bone density test just to make sure that your bones are to the right density for your age and your type. I'm not too worried about it because I'm not feeling your muscles and your bones feel like they're not shifting as I move the kneecap. So it's probably not the issue, but just to rule that out. So. Okay, go ahead and switch to the other foot. All right. Okay, the left side. So, and this is just the way that your skeletal system is this kneecap kind of tilts outward.
Okay.
So it can, over time, just create a sort of imbalance. The way that you walk, though, is pretty good. I'm not seeing any huge compensation for now. But just to let you know, if you start feeling pain or wobbliness in the knee area over time, it might be due to that. Okay. Okay. All right. Now, if you could touch your chin to your chest. Okay. Very good. Is that the furthest you can go?
Mm-hmm.
All right. So you have some limited spine mobility there. Go ahead and go back upright. Okay. And now try to, as far as you can without hurting yourself, touch your right ear to your right shoulder. Okay.
It feels pretty tense.
Yes. Oh, that's super tense. So we're going to be doing a lot of work on this left side. Go ahead and try to go the other way. Okay. Okay. So that kind of informs me where to start. I want to actually start with you sitting up on the bed.
Okay.
So I can really work on the neck and just those upper back muscles, okay?
Okay.
So I'm going to start, Ivy, by applying some anti-inflammatory oil to the base of the scalp and to the neck, okay?
Okay.
And do you mind taking off your necklaces?
Sure.
Thank you. They're very pretty, but I think it would be a lot better to have access to the full area. Okay. All right. You're going to see a little bit of redness in the back of the neck, also on your back, over the next few days. Don't panic. That just means that we've got the blood flow circulating.
Okay.
It should go away within a few days. All right. If you could, I know you said this is a bit painful, but if you could just bend your head down and try to put your chin towards your chest. You don't have to go as far as you can, just to, that's very good. How is that starting to feel?
It feels really, really good.
Okay, yeah, I'm already starting to see the left side just loosen up a little bit, so
Totally.
that's good. Okay, I'm going to be using a couple different sets of tools to apply pressure point therapy and then tapping therapy.
Okay.
Okay, so you're just going to feel a little poke. And what you're doing now is exactly perfect. Just let whatever your body wants to do in terms of tilting forward happen.
Okay.
Just go a little bit limp, but not anything to where you're efforting. Okay. You're just going to feel some tapping along the same areas that I applied the pressure point therapy to.
Okay.
I'm feeling a lot. Okay. I'm already seeing your posture change a bit in the from the mastoid bone up to your head. I'm seeing a lot less tightness here. So that's really good. I'm going to go ahead and do some work on your back.
Okay.
So if I could have you lay facing down on the table, we'll get to it.
Okay.
Okay. Okay, so I'm going to start by just doing some targeted pressure moves, okay? So when I press down here, it would behoove you to release your breath. So if you could take a deep breath in now, and now just relax and let your body fall. Okay. Go ahead and do that again. Okay. Going a little bit lower. If you could take a deep breath in and out. Good. Take a deep breath in and out. Okay. Maybe going lower, just beneath the thigh. Okay. So I'm going to be doing just some pulling work with your legs, and I want you to just release all your tension. So if you're holding any tension in the thighs, the calves, just release it and give it all to me. Okay, very good. Okay. Just doing some work with the rotators here. And this is going to help your posture and realign anything that was off center before. Okay. Okay. Okay, I'm going to be doing some cupping therapy. So this is to aid the scalene muscles and realignment, and just to center the trapezial group of muscles, which are located in the mid-back. Now I'm going to really target that left side here, so you're going to feel that same pressure, just a little bit higher. Sliding down, releasing those muscle dendrites that we tend to trap in certain areas of the body with stress, and yours happens to be right here. Okay. Now you're going to feel some slight soreness along with the redness for a few days, but nothing should feel like excruciating pain or sharp pain. So if you feel that, definitely give me a call. But I've never had it happen before, so. Okay. Okay, we're just doing some more targeted tapping therapy along the midsection of the back as well as the neck. And this just traces along the scalene muscles. To release that tension held up here to other parts of the back, and it surprisingly aids in oxygenation throughout the body. Do you tend to get cold hands and feet?
Yeah.
That happens a lot because when we have areas of stress that are condensed to a certain area of the body, it really impedes blood circulation. So when I release the tension here, it's going to really help with that in the future. Okay, Ivy, I'm going to have you just lay facing up for a few brief moments. I'm going to do some adjustments there, okay? All right, if you could take your arms and cross them like that. Okay, good. And you can press them a little bit lower. Perfect, okay. Go ahead and lift this leg here, all right? And I'm going to just apply some pressure here. 3, 2, 1. Okay, good. Okay, we're going to go the other way too. All right, and if you could switch your hands here. Perfect. Okay. 3, 2, 1. Okay. Go ahead and relax. How did that feel for you?
Feels good. It feels like there was so much tension I had not even realized.
Yeah, it's tricky how certain parts of the body where we carry stress that usually it stems from another place.
Yeah.
It's just how bodies work. Okay. So I'm going to have you sit up and we'll talk about how that went for you and maybe what the next steps are, okay? Okay, Ivy, so I released a lot of that tension on the left side of your neck. It was like literally like a ball.
Yeah.
And it smoothed out quite significantly. I'd like to see you again in a couple weeks, if that's okay for a follow-up, and we'll do pretty much the same thing. I'm going to order a bone density test for you just to be on top of the popping sensations that you're feeling in your knees, just to rule out anything serious like osteopenia or osteoporosis, which I'm not too worried about, but it's just what we do. Let's see, what else? Do you have any questions?
No, this was great.
Okay.
Really, thanks.
All right, are you feeling any soreness yet?
No, it doesn't feel sore. It just feels like a lot looser, I guess.
All right. Make sure to drink a lot of water in the next few days. It's really going to help. And if you do start to feel soreness, which I think you will within a few hours, just some light soreness, you can take ibuprofen or Motrin for that, okay?
Okay.
All right.
Sounds good.
All right, I'll see you again soon. Thank you.
Thank you.